Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Sarah from English Literature. Okay, I want to explain the title type of language disorder. What is language? Language, general understanding, is a communication tool that is arranged in the form of units such as word, group of words, clauses, and sentences that are expressed both orally and in writing. Language disorder. A child may have a language disorder if he has difficulty getting its meaning across through speech, writing, or even gesture. Some children have a language disorder even though they produce sound well and have clear speech difficulty. Okay, there are type of language disorder and three kinds. 1. Receptive language issue. 2. Expressive language issue. 3. Mixed receptive expressive language issue. Characteristic of language impairments. 1. Short utterance language length. 2. Limited vocabulary. 3. Language abilities are lower than cognitive abilities. There are some of the treatment options for speech disorder below. 1. Oral motor therapy. 2. Ear device. 3. Medication. I want to explain about characteristic of language impairments. What is speech impairment? People who have speech impairments have a hard time pronouncing different speech sound. They might distort the sounds of some words and leave other sounds out completely. The type of language disorder. Receptive language issue. Children with receptive language disorder have trouble understanding language. They have trouble grasping the meaning of words they hear and see. That includes people talking to them and words they read in books or on signs. It can cause problems with learning. It needs to treat as early possible. And expressive language issue. Expressive language disorder is a lifelong condition that impact the ability to use language. People with this language disorder understand what others are saying, but they have a hard time expressing their own ideas when they speak. Expressive language disorder isn't a speech disorder. And then, note that tests are distinct from speech disorder, which involve difficulty with the acts of speech production but not with language. How to overcome language disorders? The common treatment for language disorder is speech and will therapy treatment will depend on the age of your child and the cause of extent of the condition. For example, your child might participate in one-on-one treatment session with a speech-language therapist or attend group session. Causes of language disorder. 1. Medical condition or disabilities such as autism, brain injury, stroke, or tumor. 2. Birth defect such as Down syndrome, Fragile X syndrome, or cerebral palsy. 3. Sometimes language disorder have a family history. In many other cases, the cause is not known. And last, speech impediment. A speech impediment happens when your child's mouth, jaw, tongue, and vocal tract can work together to produce reasonable words. Left untouched, a speech impediment can make it difficult for children to learn, read, and write. Speech therapy can make a significant difference for children whose speech impediment isn't related to others' condition. Thank you very much for your attention, Mr. If I make mistake, can you give me? Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.